And spirit, have you ever noticed a change in your legs and wondered if it might mean something serious? Stay with me, because what may look like a simple ache, swelling, spirit, or discoloration could actually be your body trying to warn you about deeper health issues that become dangerous if ignored. This isn't about scaring you and spirit. It's about empowering you. I want you to recognize the signals early, take them seriously, spirit, and protect your long-term health instead of brushing them off as just aging. Imagine this: you wake up and notice your legs are more swollen than usual, and spirit, or you suddenly see veins that look twisted and bulging, or maybe you've been feeling cramps that keep returning at night. Most seniors think, well, and spirit, that's just part of getting older. But the truth is, your legs can reveal the health of your heart, your circulation, and even your nerves. And spirit, the legs are often the first place where poor circulation shows up, where diabetes leaves visible signs, or where blood clots begin. And spirit, treating these early can prevent disability, strokes, or heart complications down the line. Let's start with swelling. When your legs or ankles puff up, spirit, especially at the end of the day, it can be more than fluid from standing. Persistent swelling is often linked to circulation issues, kidney stress, spirit, or even heart strain. Many seniors assume they just need to elevate their feet, but if the swelling keeps coming back, is uneven, and spirit, or is paired with shortness of breath or fatigue, it deserves medical attention. Early help could prevent bigger problems later. Next, look at skin color. Spirit, if parts of the skin on your legs look unusually red, purple, or pale, it's not just a cosmetic issue. And spirit, redness paired with warmth can point to inflammation or infection. Pale or cold skin can mean reduced blood flow. Spirit, and darkening around the ankles may indicate chronic circulation problems that can lead to ulcers. These signs don't mean disaster. Spirit, they mean there's still time to step in and improve your vascular health with treatment and lifestyle shifts. Now let's talk about cramps and pain. And spirit, if your calves hurt only when you walk and feel better when you stop, that pattern is a classic warning sign of blocked arteries. And spirit, many seniors think it's arthritis, but pain triggered by movement is often tied to circulation. The good news: improving blood flow, checking cholesterol. Spirit, staying active and seeking treatment can slow or reverse damage. Pain that wakes you up at night or comes suddenly should never be ignored. And spirit, because early intervention is almost always easier than emergency care later, numbness and tingling are another big clue. And spirit, when nerves don't get enough blood or are damaged by diabetes, the legs often speak first. That pins and needles feeling may seem harmless, spirit, but if it continues, it can lead to serious mobility issues and increase the risk of falls or wounds that heal slowly. And spirit, recognizing numbness early helps protect mobility and prevent complications that affect quality of life. Look at the veins too, spirit. Varicose veins may seem like a cosmetic annoyance, but when they're painful, itchy, or cause swelling, they can harm circulation and skin health. Spirit, blood clots sometimes start in those damaged veins, especially if you notice sudden pain or heat. Again, this isn't a message of fear. And spirit, this is a reminder that treatment exists, and the earlier you address these issues, the better the outcome. Wounds are another major sign not to overlook. Spirit, if you have a sore on your leg or foot that isn't healing, especially with diabetes, it can signal poor blood flow or nerve damage. Spirit, a tiny wound that lingers is your body saying something deeper needs attention. Quick action can prevent infection or more serious complications. And spirit, and for many people, lifestyle changes like controlling blood sugar, quitting smoking, or wearing supportive footwear make a massive difference. Spirit, if you're a senior or care for one, the key message is this: the legs are storytellers. They reveal changes in heart health, nerve function, spirit, and circulation long before other symptoms appear. When you listen early, you can protect your independence, mobility, and overall well-being. And spirit, when you ignore them, you increase the risk of letting manageable issues turn into emergencies. So instead of dismissing leg symptoms as part of aging, and spirit, see them as early warnings and opportunities. Seek help, ask questions, stay active, keep track of changes. And spirit, and never feel embarrassed about consulting a professional, because taking action today can mean more strength, more freedom. Spirit, and more years of living the life you love. And that's what this channel is all about: awareness, prevention, and staying in control of your health and spirit. If you want more videos that help you understand the signs your body gives you and how to respond to them, spirit, make sure you subscribe and share this with someone who needs it. Your legs might just save your life, not because they predict the end, spirit, but because they show you where to begin healing. Many seniors dismiss leg symptoms as normal aging and spirit, but they can signal deeper health issues when ignored, because as we get older, we tend to accept new aches, pains, spirit, and physical changes as an unavoidable part of life. And this mindset often leads people to overlook warning signs that the body is trying to communicate. Spirit. When someone sees swelling after a long day, they might think it's just fatigue, or if their legs feel heavy in the morning. And spirit, they might assume it's simply stiffness from age. This attitude is understandable because nobody wants to think something is wrong. Spirit. And many seniors have spent years hearing that aging naturally brings discomfort. However, the legs are more than just limbs that help us walk. And spirit, they are highways of blood vessels, networks of nerves, and crucial indicators of circulation, heart function, and metabolic health. And spirit. When these systems start to struggle, the legs often reveal symptoms first, and recognizing them can be the key to catching conditions early. For example, spirit. Poor circulation can show up in the legs long before someone feels chest pain or shortness of breath. And spirit. And nerve damage can appear as tingling in the feet before it becomes debilitating elsewhere. When these early warnings are dismissed, spirit, minor issues can slowly become major problems that threaten mobility, independence, and long-term well-being. A lot of seniors normalize swelling and spirit, discoloration, cramps, or varicose veins without realizing they could be connected to something deeper. They may elevate their feet, rub on some cream, spirit, or change shoes, thinking that's enough. While those simple adjustments can help with comfort and spirit, they don't address the root cause if the real issue is blood flow, vein performance, or heart strain. Instead of viewing symptoms as random or inevitable, and spirit, it's more helpful to think of them as messages. Just like a car's check engine light signals that something needs attention, and spirit, leg symptoms can warn that the cardiovascular system is struggling or that arteries are narrowing. Spirit. This is especially important because many serious conditions develop quietly. High blood pressure, diabetes, and spirit and peripheral artery disease often advance with subtle clues before major events occur. Ignoring these clues delays treatment and allows damage to progress. Spirit, making complications harder to manage later. Another reason seniors dismiss leg symptoms is because they compare themselves to others their age. And spirit, if they see friends or relatives experiencing similar discomfort, they assume it's normal. But what's common is not always normal. Spirit. Many seniors are living with undiagnosed or poorly managed conditions. Spirit. And normalizing shared symptoms creates a cycle where everyone believes discomfort is acceptable when it shouldn't be. For instance, and spirit, constant leg cramps might be brushed off as muscle fatigue, yet they can indicate electrolyte imbalances, poor circulation, or nerve issues. Spirit. When pain becomes routine, it's easy to stop questioning it, but questions are essential. Spirit. Asking why something hurts or swells is the first step toward identifying what the body needs and preventing further decline. There's also fear involved. And spirit. Some seniors avoid discussing symptoms because they worry about receiving a diagnosis. Spirit. Or they feel they don't want to burden their families or healthcare providers. Others may believe it's too late to make changes. Spirit. Thinking age reduces the benefits of treatment. But modern healthcare offers effective ways to improve circulation, reduce pain, manage diabetes. Spirit. Prevent blood clots and strengthen cardiovascular health regardless of age. Early action isn't just about living longer, it's about living better. Seeking guidance for leg symptoms can mean avoiding severe consequences such as ulcers, infections, or mobility loss. And spirit. It can also prevent emergencies like strokes or heart attacks, which often arise from untreated circulatory issues. Even minor improvements in diet, spirit, physical activity, hydration, and medications can dramatically change outcomes when addressed early. And spirit. Leg symptoms are often the earliest physical signs of hidden conditions because the legs are furthest from the heart and require strong circulation to stay healthy. Spirit. When blood flow weakens, the legs show it before other body parts. Swelling, for example. And spirit. Happens when fluid builds up because the heart struggles to pump efficiently or veins fail to return blood properly. And spirit. Changes in skin color can indicate inflammation or restricted oxygen supply. Numbness or tingling reflects nerve stress. These aren't random nuisances. Spirit, they're signals. But when someone labels them as just aging, they miss the chance to detect heart disease, kidney issues, or diabetes at a safer stage. And spirit, that's why awareness matters. Seniors who learn to identify concerning symptoms can advocate for themselves sooner. They can discuss changes with doctors, spirit, adjust habits, and monitor progress. This proactive approach helps prevent severe complications that might otherwise lead to hospitalization, surgery, spirit, or permanent mobility loss. Mobility is central to independence. Legs allow people to move freely, exercise, socialize, and maintain balance. And spirit. When leg health declines, quality of life often declines with it. Ignoring symptoms can result in reduced activity, which weakens muscles, increases fall risk and spirit, and worsens circulation further. This cycle accelerates physical decline and creates frustration and isolation. Spirit. What starts as minor swelling or occasional pain can gradually evolve into difficulty walking, increased fatigue, or reliance on mobility aids. And spirit. But early recognition interrupts the cycle. Addressing symptoms ensures continued movement, which maintains strength, balance, and endurance. And spirit. Seniors who pay attention to leg health are more likely to stay active, manage weight, control blood sugar, and support cardiovascular health. And spirit. These benefits ripple into emotional well-being, confidence, and social engagement. There's also an educational gap. And spirit. Many seniors simply haven't been taught which symptoms matter. They know chest pain is serious and spirit, but they may not know that calf pain while walking can signal arterial blockages. They might connect numbness with circulation issues, but not with diabetes. And spirit. Building awareness helps fill this gap and encourages people to listen to their bodies with curiosity rather than fear. Spirit. It empowers them to act instead of dismiss. The shift from "it's just aging" to "this could be important" is transformative. It motivates timely action, and spirit encourages lifestyle improvements and opens doors to diagnosis and treatment before complications set in. Ultimately, the main problem isn't aging itself. Spirit. It's the belief that aging excuses symptoms that deserve evaluation. Normal age-related changes exist, of course, and spirit. But distinguishing between harmless and harmful signs is essential. When seniors understand that leg symptoms can reflect underlying health conditions, spirit, they begin to view their bodies differently. They start noticing patterns, tracking changes, and seeking help earlier. This awareness leads to better outcomes, less pain, greater independence, and stronger protection against preventable issues. The legs provide early clues that the heart, veins, nerves, spirit, or kidneys need attention, and listening to those clues can mean the difference between small interventions now and serious complications later. And spirit. Swelling in the legs and ankles can indicate circulation problems, kidney stress, or heart strain. Spirit. Especially when it becomes persistent or appears without an obvious cause, and the reason this happens is rooted in how the body moves fluid and blood. Spirit. The legs are the farthest point from the heart, which means the circulatory system needs to work harder to push blood upward against gravity. And spirit. When the heart isn't pumping efficiently or the veins aren't returning blood properly, fluid begins to pool in the lower limbs. Spirit. Many seniors assume this swelling is harmless, but when it keeps recurring or worsens over time, it may reveal early signs of chronic venous insufficiency. And spirit. Congestive heart issues or even kidney complications. Swelling might start small, appearing only at the end of the day or after standing for long periods. Spirit. But over weeks or months, it can grow more noticeable, and that progression is a sign that something deeper is happening. And spirit. For example, heart strain can cause swelling because when the heart struggles to pump blood effectively, fluid begins to accumulate in tissues. And spirit. Particularly in the legs and ankles. If you press on the swollen area and the skin leaves an indentation that takes time to disappear. And spirit. That's often a sign of fluid retention known as edema. When the heart is under stress, blood flow slows and pressure builds in the veins. Spirit, pushing fluid into surrounding tissues. Some seniors might also feel shortness of breath or fatigue along with swelling. Spirit, which can hint that the heart is being overworked. These symptoms are messages that circulation isn't functioning at its best. Spirit, and ignoring them allows strain to continue until the heart becomes more compromised. Spirit, early attention can prevent the situation from worsening and support heart health with lifestyle changes or prescribed medication. Spirit, kidney stress is another major factor linked to swelling. The kidneys act as filters that remove excess fluid and waste from the bloodstream. Spirit, when the kidneys aren't functioning properly, they can't regulate fluid balance, leading to swelling in the legs. In some cases, and spirit, swelling tied to kidney issues might also appear around the eyes or in the hands, but the legs often show it first because they're most affected by gravity. And spirit, people might dismiss swelling as just a sign of water retention or think reducing salt is enough, but if the root cause is kidney-related. Spirit, ignoring it allows more damage. When swelling persists despite changes in diet or daily habits, it's an indicator that the kidneys need attention. Spirit, the sooner kidney issues are identified, the more likely they can be managed, preventing further decline. Circulation problems are a common cause of swelling. Spirit, especially in seniors who have weakened veins or valves in the legs. Over time, veins may lose elasticity or become damaged. Spirit, making it harder for blood to travel upward. This condition, known as venous insufficiency, can cause blood to pool in the legs, leading to swelling. Spirit, visible veins and sometimes skin changes. Seniors might notice their legs feel heavy or achy, particularly after long periods of standing or sitting. And spirit, they might see skin darkening around the ankles or notice itching or dryness. These changes don't happen randomly. And spirit, they reflect stress on the veins and circulation system. Early signs might be mild, but if they're ignored, they can progress to skin ulcers or infections. And spirit, which are much more difficult to treat. Many seniors are unaware that swelling can also signal blood clots. When swelling appears suddenly, is painful. Spirit, or affects only one leg, it may be a sign of deep vein thrombosis. This condition requires urgent evaluation because if a clot travels to the lungs and spirit, it can become life-threatening. While not all swelling points toward blood clots, recognizing which types require urgent response is essential. And spirit, swelling that appears out of nowhere, especially with warmth or tenderness, should not be dismissed as tiredness or strain. Spirit, it's better to seek clarity than risk complications. Although swelling can be tied to underlying conditions, lifestyle factors also play a role. Spirit, long hours of inactivity, dehydration, and excessive salt intake can contribute to fluid retention. Seniors who sit for prolonged periods, whether watching TV, and spirit, working on hobbies or riding long distances, can experience swelling because muscles act as pumps that help move blood through veins. Without movement and spirit, circulation slows, making swelling more likely. Hydration is also essential because when the body doesn't receive enough water and spirit, it holds onto fluid as a protective mechanism, leading to swelling. And spirit, understanding these connections helps seniors recognize patterns and adjust habits before swelling becomes chronic. And spirit, another misunderstood aspect of swelling is its link to medications. Some common prescriptions, including those for blood pressure, diabetes, or inflammation, spirit, can cause swelling as a side effect. Seniors may notice swelling after starting a new medication and assume it's simply coincidence or aging. And spirit, but speaking with a healthcare provider can uncover whether the drug is contributing to the problem and if alternatives or dosage changes are appropriate. Spirit, ignoring medication-related swelling can lead to prolonged discomfort and preventable stress on the body. In addition, swelling can reveal inflammation. And spirit, when joints or tissues are irritated, fluid gathers as the body attempts to heal. Arthritis, injury, or infection can all trigger localized swelling. And spirit, seniors who have arthritis may accept swelling as part of their condition. Spirit, but sudden changes or increased swelling could indicate worsening inflammation or new complications. When inflammation is managed early, pain decreases. And spirit, mobility improves and long-term joint damage can be reduced. Accepting swelling without question leads to stagnation. Spirit, but asking what's behind it encourages proactive care. Swelling isn't always painful, and that's part of what makes it easy to ignore. Spirit. People often assume that if something doesn't hurt, it isn't serious. But many underlying conditions begin silently. And spirit. Kidney disease may not cause pain until it's advanced. Heart issues may feel mild at first. Vein problems might only cause discomfort late in progression. The absence of pain is not a guarantee of safety. Spirit, recognizing that painless swelling can still be significant, allows seniors to seek evaluation before complications appear. Swelling also affects daily life. And spirit, it can make shoes feel tight, contribute to stiffness, reduce mobility, and increase the risk of falls. When legs feel heavy or tender, and spirit, walking becomes more challenging, which leads to less activity. Less activity further weakens circulation, creating a cycle where swelling grows worse. And spirit, breaking this cycle requires noticing changes early and responding appropriately, rather than adapting to discomfort until it becomes disabling. Spirit, understanding the cause of swelling empowers seniors to take control of their health. When swelling is viewed as a normal part of aging, spirit, opportunities for prevention are missed. But when it's seen as a message from the body, it becomes a starting point for investigation and positive change. Spirit, the legs reveal important information about the heart, kidney circulation, and overall fluid balance. And spirit, and taking swelling seriously allows interventions that protect long-term mobility, comfort, and independence. Spirit, seniors who pay attention to persistent or unexplained swelling improve their chances of addressing potentially serious conditions sooner. And spirit, supporting better health outcomes and maintaining quality of life, because swelling is not simply a cosmetic issue or a minor inconvenience. And spirit, it is often the body's way of drawing attention to an imbalance that needs care and support. And spirit, and ignoring it allows the underlying problem to continue silently until it becomes more challenging to manage. And spirit, while acknowledging it, opens the door to early diagnosis, effective treatment, and prevention of further complications that could impact daily living, spirit, mobility, and overall well-being, even if the swelling itself seems harmless in the moment. And spirit, its presence signals that the body is experiencing stress or imbalance that deserves attention rather than dismissal. Spirit, and responding early can prevent a temporary symptom from becoming a long-term struggle. And spirit, especially when seniors understand that swelling is not random, but a reflection of how well the body is functioning overall. And that's why recognizing and addressing swelling in the legs and ankles is so important, because it offers one of the earliest and clearest warnings that circulation, heart function, and spirit or kidney performance may need support, and that early action can make the difference between manageable adjustments and more serious consequences that affect independence, spirit, energy, and daily comfort in ways that could otherwise have been prevented if the signal had been acknowledged rather than overlooked. Spirit. So learning to recognize persistent swelling as a sign worth investigating is a powerful step toward protecting health, mobility, and spirit, and overall quality of life, rather than writing it off as just another part of aging and allowing the body's warning signs to go unheard, because paying attention to these changes and taking them seriously creates an opportunity for intervention, spirit, prevention, and improved well-being before complications grow more severe and limit the ability to move freely, maintain activity, or enjoy daily routines in the way seniors deserve. And spirit, especially when small warning signs are caught early and addressed thoughtfully rather than ignored and allowed to progress unnoticed. Spirit, which is why understanding the significance of swelling is such an important part of recognizing and responding to the silent warnings the body gives before more serious health challenges begin to develop and impact life in ways that could have been managed more easily if caught early. And spirit, because swelling is often the first indicator of changes that need to be acknowledged rather than brushed aside as an unavoidable part of getting older. Spirit, and paying attention to it creates the chance to support better health outcomes through awareness, communication, and spirit, and timely action instead of waiting until the situation becomes more complex and harder to manage. And spirit, especially when those early signs appear in the legs and ankles, where gravity and circulation reveal the earliest shifts in how well the body is handling fluid balance and cardiovascular strain, because this area shows those clues sooner than other parts of the body. And spirit, making it an essential place to observe when watching for meaningful changes that require attention and care, and though many seniors may not realize it. Spirit, taking swelling seriously can lead to earlier intervention, better symptom management, and spirit, an improved long-term health when addressed rather than ignored or normalized as something that cannot be changed or improved, because recognizing these signs offers a path to prevention and support, rather than hoping the issue will resolve on its own without addressing the underlying cause. Spirit, which is why swelling in the legs and ankles deserves attention, especially when it is persistent or unexplained. And spirit, because it is one of the body's clearest ways of signaling that something needs to be acknowledged and addressed rather than overlooked or minimized. And when seniors understand this, spirit, they can take steps toward better health outcomes by noticing changes early and seeking support before they escalate into more serious challenges that affect mobility, spirit, independence, and overall well-being, creating an opportunity for intervention improvement. Spirit, and support rather than accepting the symptom as inevitable without exploring what might be causing it and what can be done to address it and improve comfort. And spirit, health and quality of life, since swelling can be managed most effectively when it is recognized early and taken seriously. And spirit, especially in seniors who may be at higher risk for circulatory, cardiac, spirit, or kidney-related conditions that reveal themselves first through changes in the legs and ankles, which means it is worth paying close attention to these signs and responding to them rather than dismissing them as normal aging or temporary discomfort, because doing so allows the underlying issues to continue without intervention and potentially grow more serious over time if low recognized and left unrecognized and unaddressed. And spirit, making early awareness and attention crucial for maintaining health, mobility, and spirit and independence for as long as possible through informed choices and timely action instead of delay or to symptoms to worsen and create additional challenges at the early steps to address the body's signal something may need support or evaluation. And that is why understanding the importance of swelling, what it may indicate, is such a critical part of maintaining our health as we age, because this awareness to prevention wasn't missed away or the need for relation. Spirit, intervention, and better well, being rather than accepting the symptom as unavoidable without sparing its causes and taking steps to support the body's needs. When it reveals these early warning signals through changes in fluid retention and circulation in the lower limbs, which deserve attention or reflect circulation and challenges or signs of organ stress that can be recognized early rather than after complications, so that it's responding or attack them laying, rather than assuming that swelling is normal and or allowing me meaningful warning signs to go on meaningful or warnings dismissal and spirit, especially when early recognition offers a path to better outcomes rather than waiting for further complications that could have been prevented with early awareness and support for the underlying is the body is trying to communicate through swelling in the legs and ankles, which is why paying attention to these signs and understanding their significance is essential for seniors who want to maintain issues who want to maintain health, spirit, mobility, spirit, and independence as they age and avoid the progression of preventable challenges that begin with these early signals from the body that should be heard rather than dismissed or ignored, because recognizing can mean the difference that affect daily life and overall well-being. Even more serious cases is that affect overall well-being. When nobody is trying to as me by looking and dismissal is meaning only overlooking what probably aging. And spirit, since swelling in this area is one of the clearest early indicators that circulation, kidney function, spirit, or heart performance may need evaluation and support, even when the symptom seems small or harmless at first, because that early signal is an opportunity to act before the underlying issue grows more complex and challenging to manage. And spirit, making early awareness and attention crucial for seniors who want to maintain their health rather than ignoring the subtle changes that can reveal important information about cardiovascular and kidney health. Period, particularly when it appears consistently or without explanation and deserves acknowledgement and investigation rather than dismissal as part of getting older, because swelling offers important significant rather than changes in this report the quite to support their whole population or the everything that is or that's what they want for such a list and spirit, especially when early intervention can make a meaningful difference in outcomes and comfort for seniors who pay attention to these signs and respond to them rather than dismissing them as unimportant or inevitable, while the body continues to give signals through this persistent change in fluid balance, spirit, circulation, and organ function that may require evaluation and support in order to maintain comfort, independence, and spirit, and health, rather than allowing the underlying issue to continue without recognition or assistance while swelling persists and reflects the body's effort to signal that something further deserves attention and care, rather than being overlooked as a simple effect of age, recognize an important and respondity to support overall health rather than allowing the issue to progress and make day late morning not over eternity a circular latest other than the length of as the circular light. Kidney function and spirit or heart performance continue to experience stress without acknowledgement or assistance that could have been provided sooner to support well-being and prevent further strain until the early signs had been recognized rather than dismissed insignificant or unavoidable, and that is why the presence of swelling should prompt awareness, attention, and evaluation rather than denial or minimization, especially when it is recurring or unexplained, period, as it may reflect deeper health issues that deserve support, evaluation, and spirit, and care rather than continued oversight and dismissal, even if the symptom appears minor at first and seems like a normal part of aging, because taking it seriously can help prevent more significant challenges who are developing and support better outcomes for seniors who recognize that swelling in the legs and punt and pose is a meaningful signal rather than a trivial or unimportant change. Persistent or increases over time rather than resolving quickly on its own, and should therefore be acknowledged rather than assumed to be harmless or inevitable without exploring what might be causing it and how it can be addressed to support better and comfort continues to give signals to best evaluation and emergency events to base the certain information rather than being ignored or minimized. As I mentioned in my yes, and given as an east-minded, it's been from understanding what I may be secular. Kidney function, spirit, or heart health, because recognizing and responding to this change early supports better outcomes and allows for intervention and assistance rather than delay or dismissal that might prevent seniors from receiving the support they need to protect their health and mobility, especially when the early signs begin with something simple as soiling in the leg example, as swelling in the legs and ankles, and spirit, which deserves thoughtful attention rather than being ignored or brushed aside as just another part of aging that cannot be changed, since swelling is often the first meaningful sign that the body is trying to communicate changes in circulation, spirit, or organ function, and responding to this signal early supports better health outcomes rather than allowing the underlying issue to progress until it becomes more difficult to manage or reverse, period, especially for seniors who deserve the chance to notice, understand these irons rather than overlooking them and missing the opportunity to protect their well-being, comfort as they continue to age and monitor their health as they can monitor their health in ways that support long-term independence and daily function rather than ignoring the clear signals and doing dismissal as significant and rather than continue with circulation from the man is coming in with the body. and spirit. Comfort and spirit and independence if they are not recognized and addressed early while swelling persists and reflects the body's attempt to communicate a need for attention and support rather than especially when it appears it deserves consideration rather than being overlooked as aging, because it may indicate issues that require attention rather than ignored as something that proved then minimized or changed or improved. And earlier this recognition was the better the chance of supporting the body effectively rather than waiting until the issue progresses and becomes more complex to address, since swelling in the legs and ankles often reflects deeper issues that need attention rather than being dismissed or normalized, even if the symptom appears minor or painless at first and deserves recognition and insufficiency rather than ignition or responsibility. It's important that we the pain reaction condition of run away spirit. Kidney, spirit or heart strain that can be managed more effectively when recognized early and addressed rather than ignored and allowed to progress unnoticed into more challenging conditions, which is why persistent swelling in Lord. But deserves to be acknowledged as an important sign, because of always pleased that the body may be experiencing stress rather than being minimized or overlooked as some insignificant, overlooked as some insignificant, overlooked or the load minimized. Especially when it continues over time and reflects the body's effort to communicate a need for support rather than silence, as it signals shifts in circulation and fluid balance that deserve recognition and may indicate deeper issues when be addressed when noticed early rather than after complications develop, or than after opportunity to protect the leg rather than the legs and the legs and evaluation. Prevention, spirit, and support before the issue progresses and creates additional challenges that could have been minimized if swelling had been unsignaled rather than ignored or normalized without consideration of it, may indicate about deeper health need. And recognizing this early sign creates the opportunity for seniors to take control and end the dependence rather than warning these signs of swelling remains on the sweat, on the elements, on the breast, as well as rather than rowing these highlight and sword or the eyes. Period. Even though it may be the body's clearest and earliest indication that circulation, kidney function, spirit, or heart performance requires attention and support, rather than neglect or dismissal as the symptom that appears in the lower limbs and reflects the impact of fluid imbalance and circulatory stress that deserves evaluation, rather than being minimized or ignored. When it is persistent and unexplained and therefore should prompt awareness and consideration rather than dismissal as an unavoidable part of aging, because the body uses this change to signal a need for attention and to help prevent further complications and protect overholders and people is protection can't be a performance of this one of this impact. It's fun to the long look back to what you see so forth. Now fell away, so handle like making spirit, kidneys, and spirit, and veins. Even before more severe symptoms appear, it attempts to communicate it should change in the lower limbs, which deserves attention rather than dismissal, because taking it seriously allows seniors to respond early and protect their health rather than allowing the underlying causes swelling persist, and for foiling discord for support and evaluation, rather the symptoms to be manageable with the first and appears to be manageable with spirit, though it may actually indicate a deeper issue that requires support to prevent further complications and maintain well-being as the body continues to communicate through this swelling in the legs and ankles, which has an importation and care or looked or minimized this special report sign rather than being over the minimal or issues or the antiphilus messages or through events and circulation and the issues in the lower line and being spirit Awareness and attention rather than dismissal, as it may reflect deeper challenges that need support rather than being overlooked as unimportant or unavoidable even when the symptom appears small or painless at first, and should therefore be recognized as an important indicator rather than being written off as insignificant. Spirit, because swelling may be the body's earliest attempt to communicate a need for attention rather than being ignored as unimportant. And spirit, especially when it persists and reflects changes that may require evaluation rather than being minimized or overlooked simply because it appears to be a common experience among seniors. Spirit, even though it may be signaling a deeper issue that requires support and understanding rather than dismissal as normal aging, without recognizing the importance of this early sign of potential health changes that deserve attention rather than neglect. Spirit, because when swelling persists or increases over time, it reflects the body's attempt to communicate that something deeper may be occurring and deserves awareness and evaluation, rather than being dismissed as trivial or inevitable, even if the symptom appears minor at first, because early recognition, which might allow the underlying issue to progress something deeper, arrive quickly or being attempted and impenetrable, and in times as important or appointment in the need, where the main point of attempt is slowly body pollution and correctly for one word for the smelling or to relation. Kidney function. That for a former to require earlier to accomplish and protect overall issue, protect overall health and mobility, rather than allowing the underlying issue to progress challenged, while swelling unnoticed, while swelling continues to reflect the body's need for assistance, rather than dismissed early and health and dismissed the important mission or addition for recognition and relation rather than normalizing that changes and channel time Period. Because this persistent swelling in the legs and ankles may be the body's earliest attempt to communicate that circulation, kidney function. Requires attention rather than overlooked or minimized without recognition of its importance as an early warning sign of deeper changes that deserve awareness rather than dismissal, so that seniors can respond early and support their well-being rather than allowing the lung issue to continue to appear in the lower ganglia for hope and everyone opinion of the T action. And so right back in a dismissal, was a portal and why I just and spirit, because swelling in the legs and ankles is often the body's earliest and most noticeable signal that deserves attention, rather than being dismissed as normal aging without understanding what it may indicate about circulation. And spirit, kidney function or heart health, and responding early allows for better outcomes rather than waiting until more serious symptoms appear and limit mobility. Spirit, comfort, spirit, and independence in ways that could have been prevented if the early sign of swelling had been recognized and taken seriously rather than overlooked or ignored as something insignificant, when it may actually reflect important changes that deserve evaluation and support rather than dismissal. And spirit, because this persistent or unexplained swelling in the lower limbs is a meaningful signal that requires awareness and recognition rather than being ignored or minimized. And spirit, especially when it continues over time and reflects the body's attempt to communicate underlying stress or imbalance that deserves support rather than dismissal as insignificant or unavoidable, since swelling may be the body's first and clearest sign that something deep is occurring and should be acknowledged rather than overlooked or ignored. Spirit, particularly when it persists and reflects changes that require attention and evaluation rather than dismissal, as it signals shifts in circulation, fluid retention. Minimizes because taking it seems small at first, because taking seriously preventing a little bit more seriously for from well-being, but the more which is able to tell which are all better and all on this pointing. Numbness origin or the underlying you can see producing the other signs of all the land you can remember like you should time to remain to recommend about going or you can have the end of just because it's the volume for that which then all this all time and go behind up and I just hope to listen to the virus there are this is never well I was a project next. Even though we're very first, the little issues that deserve attention as the body continues to signal its needs through the swelling, which should be acknowledged. It doesn't be acknowledged and understood rather than being overloaded and may send on it out, recognizing its potential. Spirit, especially when swelling persists or increases over time and reflects the body's attempt to communicate changes in circulation and organ function that require awareness and support rather than permit so that seniors can take control of their health and respond rather than the unrecognition or Irish needs. The visibly sign continues to appear and recognize needs that understood rather than ignored or dismissed. Respond important because respond and then order allows for spirit. So the circulation of movement begins something very seen then the person swallowing the lesson is a scenario and being deserved around the penis and sees why on the being defensive and intimation all forces must amount and even some support which is support and not even some support in my kidney function or health before more serious changes for symptoms appear and create further challenges for seniors who want to maintain independence and comfort, rather than allowing the underlying issue to progress without recognition, while swelling continues to reflect the body that something indicated samipa is occurring and deserves attention. So other than being ignored and minimized with the cause without an important sign that I made on the maximum you report the own I was back more and what's the wrong in the moving for isn't all along in the eastern spirit or organ function that require awareness and attention rather than being overlooked as insignificant or inevitable, even though it may seem small at first and should therefore a part of aging when them being dismissed as a normal part of aging. When it being a deeper health, need action rather than being about after we've been challenged and is mild or in more action miss as insignificant becoming hairs mind or mention this symptom divided all and this spirit. Changes in skin color on the legs can reveal inflammation, infection, or reduced blood flow. Spirit. And while many people assume discoloration is simply a cosmetic issue or a sign of aging, spirit. It is actually one of the body's most powerful visual warning signals. The skin is like a mirror reflecting what is happening beneath the surface, and spirit, especially in the legs where circulation and nerve function are tested the most. When the legs start shifting in color, turning red, pale, blue, purple, and spirit, or dark brown, it's often because something deeper is affecting the blood vessels, tissues, or oxygen levels, and spirit. The reason this matters so much is that reduced blood flow or inflammation can be early signs of conditions that threaten mobility and overall health. Spirit. When the body struggles to deliver oxygen or nutrients, the skin begins responding immediately, and spirit. And this response is visible long before intense pain or other symptoms surface, and spirit. That's why noticing and taking discoloration seriously can make the difference between early intervention and late stage complications that become difficult to manage. And spirit. One of the most common color changes is redness, which many seniors associate with simple irritation or dry skin. But persistent redness can indicate infection or vein inflammation. For example, cellulitis, a bacterial infection, often appears as warm red, and spirit and tender skin. Ignoring it and assuming it's just irritation can allow the infection to spread and become dangerous. And spirit. Redness can also point to inflammation caused by varicose veins or thrombophlebitis, conditions where veins become irritated or damaged. Spirit. The heat and redness aren't just surface reactions, they're signals that inflammation is escalating and the circulatory system is struggling. If a person consistently sees red patches or streaks, especially if the skin feels warm or painful, and spirit, it's important to recognize that this could be the body's way of asking for help before the problem becomes severe. On the opposite end of the spectrum, and spirit, pale or extremely light skin can be a sign of reduced blood flow. When circulation weakens, oxygenated blood doesn't reach the tissues properly. And spirit, this lack of oxygen leads to paleness, especially when a person elevates their legs or stands up quickly. Spirit. A leg that suddenly becomes pale or remains pale for long periods may indicate that arteries are narrowing, a symptom of peripheral artery disease. And spirit. Many seniors overlook this or chalk it up to weather changes, but recurring paleness is a strong indication that blood isn't flowing the way it should. Spirit. When oxygen supply continues to decline, tissues become stressed and the risk of pain, cramping, and even tissue damage increases. Spirit. This is why paleness should never be ignored, especially if other signs accompany it, such as coldness, numbness, or weak pulses in the feet. And spirit, blue or purple discoloration is perhaps one of the most alarming signs because it reveals inadequate oxygenation. When blood doesn't circulate effectively. And spirit, carbon dioxide builds up in the veins, giving the skin a bluish tint. This can signal venous insufficiency, where veins fail to push blood back to the heart. Spirit. It can also indicate more serious issues like blood clots or severe circulatory compromise. Spirit. Many seniors notice this color when they've been sitting for long hours or when their legs hang down. Spirit. While this might temporarily resolve when movement resumes, repeated color changes hint at vein problems that shouldn't be dismissed. Spirit. If the discoloration remains even when the position changes, the circulation issue may be advanced. And spirit, blue or purple tones are among the most concerning because they show the body is struggling to deliver oxygen to tissues, and without intervention, spirit, tissues can begin to deteriorate. Another form of discoloration is brown or darkened patches, especially around the ankles and shins. And spirit, these darker tones often mean blood is leaking from veins into the surrounding tissues because valves in the veins are weakening. And spirit. This condition is common in chronic venous insufficiency and varicose veins. The brown color comes from iron in the blood staining the skin. Spirit. Seniors often treat this discoloration as a normal skin change without realizing it's a sign of long-term vein stress and poor circulation. Over time, and spirit, these dark patches can evolve into thick, leathery skin or even open ulcers if ignored. The challenge with brown discoloration is that it develops gradually, and spirit, making it easy to dismiss, but gradual doesn't mean harmless. It reflects ongoing damage that worsens silently unless addressed. And spirit, purple spots or blotches can indicate bruising or fragile blood vessels, especially in seniors with thinning skin or those on blood-thinning medications. Spirit, while occasional bruising may be normal, frequent or unexplained bruises can signal platelet issues, clotting disorders, or vessel weakness. And spirit. Seniors sometimes blame these marks on bumping into objects, but recurrent bruising without clear cause needs attention. The body shouldn't bruise easily, spirit, and when it does, it's a sign that blood vessels or clotting mechanisms aren't functioning properly. And spirit, these signs can link to deeper concerns such as vitamin deficiencies, medication side effects, or vascular problems. And spirit, observing these changes and discussing them with a healthcare provider can reveal underlying issues that might otherwise go unnoticed. And spirit, inflammation-based discoloration often follows a predictable pattern: redness, then purple or blue tones, then brown patches if left untreated. And spirit, each stage reflects worsening circulation and increasing vein stress. That's why catching the changes early matters. When someone sees a red patch, and spirit, they have a better chance of addressing the cause before it progresses to chronic issues or tissue damage. Spirit. But if the discoloration is ignored long enough to reach dark brown tones, it often means the condition has been present and worsening for years. And spirit. Many seniors don't realize their skin is telling this story because the change develops slowly, making it feel normal rather than alarming. However, spirit, the body is clear discoloration means the legs are facing strain and need help. Skin color changes also affect texture. And spirit, areas with poor circulation may become shiny, thin or dry. This occurs because when tissues don't receive enough nutrients, they weaken. And spirit, combined with discoloration, these changes provide more clues about the severity of the issue. Spirit, if someone notices discoloration plus temperature changes like coldness or warmth, or sensations like tingling and numbness, and spirit, the risk of underlying conditions increases significantly. The combination of color, temperature, spirit, and texture is like a diagnostic code telling a detailed story about circulation and nerve function. Ignoring discoloration isn't just risky. Spirit, it has long-term consequences. Untreated venous or arterial problems can lead to swelling, pain, ulcers, infection, and mobility loss. And spirit, these complications can decrease independence, undermine confidence, and increase fall risk. Spirit, many seniors assume discoloration is harmless because it doesn't always hurt at first. But pain isn't the only indicator of a problem. In fact, spirit, by the time pain arrives, the condition may already be advanced. The absence of pain doesn't mean the absence of danger. Spirit, the earlier discoloration is recognized and evaluated, the more options there are to improve circulation, reduce inflammation, prevent complications, spirit, and maintain mobility. Color changes can also serve as early signs of systemic diseases. Diabetes, heart failure, kidney problems, and spirit, and vascular disease all reveal themselves in the legs long before they become life-threatening. And spirit, the legs are often the first place to show signs because they are farthest from the heart and require strong circulation. And spirit, recognizing this means understanding that discoloration is not cosmetic, it's communication. The skin is giving early warning signs that can protect health. And spirit, prevent emergencies and preserve independence if taken seriously. Leg pain that appears during walking and eases with rest may indicate blocked arteries. Spirit. And this pattern is far more significant than most people realize because it reflects how well the body delivers blood and oxygen to the muscles. And spirit. When someone is active, especially walking or climbing stairs, their leg muscles demand oxygen to produce energy. In a healthy system, and spirit, arteries widen slightly and allow more blood to flow, supplying the muscles with what they need. But when arteries begin to narrow due to plaque buildup, and spirit, the flow becomes restricted and the muscles can't get enough oxygen. This shortage triggers pain, cramping, and spirit, or a sense of heaviness that makes a person slow down or stop. The moment they rest, the muscles need less oxygen. Spirit. The limited blood supply becomes sufficient again and the pain fades. That cycle, pain with movement, relief with rest, and spirit, is one of the clearest clues that circulation is compromised. Many seniors mistake this for muscle fatigue, arthritis, or aging stiffness. And spirit, but those conditions don't follow the same predictable pattern of exertion and relief. And spirit, the body is showing a direct cause and effect link between activity and oxygen shortage. Spirit, an understanding that connection can reveal hidden artery blockages before they lead to severe consequences like heart attacks, strokes, or gangrene. And spirit, this type of leg pain has a medical name, claudication, and it's often associated with peripheral artery disease, which occurs when plaque from cholesterol, fat, or calcium builds up in the arteries. And spirit, the legs are especially vulnerable because they're far from the heart and rely on strong blood flow to function during movement. When arteries narrow, and spirit, the muscles are essentially starved of oxygen every time a person tries to walk, even at a normal pace. Many seniors start noticing this subtly. And spirit, maybe they used to walk a mile easily, but now they feel tightness or pain in their calves after half that distance. They might rest on a bench, feel better, and spirit, and continue. Over time, the distance they can walk without pain gets shorter, and the discomfort becomes more intense. Spirit, but because the pain disappears with rest, they may ignore the warning signs. They assume the problem is aging or weak muscles. Spirit, and they don't realize the arteries are changing. This slow, progressive decline is dangerous because it allows the disease to advance silently. And spirit, the pain becomes an early message from the circulatory system, alerting the person that plaque is limiting blood flow. If caught early, lifestyle changes, and spirit, medications, and treatment can manage the condition and prevent more serious complications. But if ignored, the narrowing continues and eventually, and spirit, even resting won't provide relief. That's when the condition becomes critical and tissue damage can begin. Spirit, another challenge is that many seniors confuse claudication with arthritis. And spirit, arthritis pain usually occurs in joints and isn't relieved simply by resting a moment. Spirit, arthritis pain tends to persist regardless of walking distance or activity level. In contrast, artery-related pain follows a clear pattern. Spirit, it starts during movement and fades quickly with rest. Understanding that difference can help someone recognize the true cause. And spirit, the location of the pain can also provide clues. Claudication often appears in the calves because these muscles require significant blood flow when walking. And spirit, if blockages are higher up, pain may appear in the thighs or buttocks. The pattern of pain can map directly to the location of the arterial blockage. Spirit, it's as if the body is drawing a roadmap of where the problem lies. Spirit, seniors who notice consistent pain in the same location during walking should take it seriously rather than assume it's random soreness. Spirit, the seriousness of blocked arteries goes beyond discomfort. When arteries narrow enough to cause noticeable pain, spirit, it means plaque buildup, has reached a level that could also affect the heart and brain. Arteries are part of one unified system. And spirit, and if plaque is forming in the leg arteries, it's likely forming elsewhere. That's why claudication isn't just a leg issue, it's a full body warning sign. Spirit, research shows that people with peripheral artery disease have a higher risk of heart attack and stroke because the same factors, smoking, high blood pressure, and spirit, high cholesterol, diabetes, affect all major arteries. Leg pain becomes an early indicator of a broader health threat. Spirit, it gives an opportunity to address risk factors before they lead to life-threatening events. Spirit. That's why recognizing this symptom and seeking medical evaluation is so important. Tests like ankle brachial index measurements, ultrasound, spirit, or CT scans can reveal the extent of blockage and guide treatment. Early detection allows for interventions that improve circulation, relieve symptoms, and protect long-term health. And spirit, ignoring the pain or assuming it's normal aging often leads to reduced activity. When walking becomes uncomfortable, seniors naturally start walking less. Spirit, they take fewer steps, choose shortcuts, avoid stairs, or stay home instead of going out. While this avoidance may prevent pain temporarily, and spirit, it worsens the underlying condition. The leg muscles weaken, circulation declines even further, and the arteries continue to narrow. Spirit, reduced movement leads to weight gain, increased blood pressure, and insulin resistance. All of these factors accelerate plaque buildup. And spirit, what begins as pain during walking can snowball into a cycle of declining mobility and increasing cardiovascular risk. The person might also lose confidence. And spirit, worry about falling or feel embarrassed when they need to stop and rest frequently. These emotional effects can lead to isolation or depression. And spirit, a symptom that could have prompted early intervention, instead becomes the first step toward mobility loss and diminished independence. Spirit, but the cycle can be interrupted. Recognizing claudication early allows seniors to adopt strategies that improve circulation. And spirit, such as walking programs that encourage gradual movement, medications to thin blood, dietary changes to lower cholesterol. Spirit, or treatments that open blocked arteries. These actions not only relieve leg pain, but also reduce cardiovascular risk and protect long-term health. And spirit, the pattern of pain during exertion and relief during rest also highlights the remarkable adaptability of the body. Spirit, the circulatory system adjusts constantly to meet the demands of muscles. When there's a blockage, the body sometimes forms collateral vessels. And spirit, small bypass pathways to try to improve blood flow. However, collateral circulation can only compensate so much. And spirit, the pain appears when the demand exceeds the supply. This is why symptoms often worsen over time. Initially, spirit, mild plaque, may only cause pain during long walks or steep climbs, but as blockages grow, even short distances or gentle slopes trigger discomfort. Eventually, spirit, pain can appear while doing routine household tasks or walking from the living room to the kitchen. In advanced stages, pain may occur even at rest, and spirit, especially at night when blood pressure drops and circulation becomes weaker. Period. This shift from pain only during activity to pain during rest signals that the condition is becoming severe and tissue damage may begin. At that stage, ulcers and spirit, infections or gangrene become possible, and medical intervention becomes urgent. Understanding the symptom pattern empowers individuals to act early. And spirit. When seniors learn that leg pain relieved by rest is not just fatigue, but a circulation issue, they can take notice sooner. And spirit, they may track how far they can walk before pain begins. They may notice whether the pain always returns in the same location. And spirit, they may see gradual changes over weeks or months. These observations provide valuable information for healthcare providers and can lead to early diagnosis. Spirit. The sooner treatment begins, the better the outcome. Arteries can be protected, circulation can improve, and quality of life can be preserved. Spirit. Recognizing this symptom isn't about causing fear, it's about understanding the body's signals. The pain is not random, it is communication. Spirit. It tells a story about blood flow, oxygen, and the health of the arteries. And spirit. Listening to that story gives people the chance to intervene before the situation becomes dangerous, to maintain mobility and independence. Spirit. And to protect not just their legs but their heart and brain as well. Spirit. Constant nighttime cramps or sudden leg pain can be warning signs of circulation problems that require medical attention. Spirit. And although many people dismiss them as dehydration, tired muscles, or simply sleeping in a bad position. And spirit. The reality is that these episodes often reveal deeper issues involving blood flow, nerve function, and metabolic health. When the legs cramp at night, and spirit, especially in seniors, it's usually because the muscles are struggling to receive adequate oxygen and nutrients. And spirit. And this challenge becomes more noticeable when the body is at rest. During the daytime, movement helps push blood through the veins and arteries. And spirit. But when a person sleeps, circulation naturally slows, and if there are underlying blockages or weakened vessels, the muscles begin reacting. They tighten, spirit, seize up, or produce sharp pains that force the person awake. This pattern is not random. It's an early form of communication from the body, spirit, signaling that the circulatory system may be struggling to keep up with the muscles' needs even when demand is low. And spirit. People often assume nighttime cramps are harmless, but when they occur repeatedly, especially in seniors, spirit, they can be one of the earliest and most underestimated signs of peripheral artery disease, venous insufficiency, or other vascular issues. And spirit. One key factor behind nighttime cramps is reduced blood flow. When arteries narrow due to plaque buildup, spirit, they struggle to carry enough oxygen-rich blood to the legs. During the day, walking or moving forces the blood forward, but at night, and spirit, lying still removes that advantage. The muscles become oxygen deprived, triggering painful spasms. Seniors may notice these cramps in the calves, feet, spirit, or thighs, and they may describe them as tightening, twisting, or stabbing sensations. And spirit, the fact that the pain often eases when they stand up or walk around is another clue. Movement boosts circulation, temporarily resolving the oxygen deficit. Spirit. Many people chalk this up to stretching, but the relief actually comes from improved blood flow. When this becomes a repeated cycle, pain at night, and spirit, relief with movement, it signals a deeper issue than ordinary muscle fatigue. Dehydration is another factor often blamed for cramps. And spirit. And while low hydration or electrolyte imbalances can contribute, those causes are usually temporary and easily corrected. Spirit. True circulation-related cramps persist even when hydration is adequate. And spirit. Seniors who find themselves waking multiple nights a week, despite drinking enough water, should not assume the issue is minor. And spirit. Electrolytes and hydration matter, of course, but circulation problems are far more common in older adults, especially those with diabetes. And spirit. High blood pressure, high cholesterol, or a history of smoking. These conditions damage blood vessels over time. Spirit. Making nighttime cramps a symptom rather than an isolated event. And spirit. Many seniors live with undiagnosed vascular disease because the earliest signs seem easy to shrug off. If cramps are frequent, severe, or worsening, and spirit, they deserve attention because they indicate that circulation is failing to supply the muscles. And spirit. Another overlooked cause of nighttime leg pain is venous insufficiency. While arteries bring blood to the legs, veins return it to the heart. And spirit. If the valves in the veins weaken, blood pools in the legs rather than flowing upward. At night, when gravity no longer helps. And spirit. This pooling becomes more noticeable. Pressure builds in the veins, causing discomfort, heaviness, and cramping. And spirit. The legs may also feel restless or twitch involuntarily. Many seniors describe needing to hang their legs off the bed or stand for relief. And spirit. That instinct is the body's attempt to use gravity to improve venous return. Spirit. The fact that this behavior provides temporary relief is another clue that circulation is involved. If cramps were only due to dehydration or muscle strain, spirit, changing position wouldn't consistently ease them. And spirit. Recognizing this distinction helps seniors understand when cramps are harmless and when they might signal a chronic vein or artery problem. And spirit. In more advanced cases, nighttime pain can signal that circulation is severely restricted. When blood flow becomes critically low, spirit. Pain can occur not only during exertion but also during rest, especially when the legs are elevated. Spirit. Seniors with advanced peripheral artery disease often say the pain worsens when lying down and improves when sitting or standing. Spirit. This positioning effect is a hallmark of arterial blockage. Spirit. It means the muscles are struggling so intensely for oxygen that even the low demand of rest isn't being met. Without intervention, this stage can lead to long-term damage, tissue breakdown, and non-healing wounds. And spirit. Some may even develop ulcers or gangrene if blood flow becomes dangerously limited. These extreme outcomes don't happen overnight. Spirit. But nighttime cramps can be the earliest sign on that trajectory. Addressing them early prevents progression and protects long-term mobility. Spirit. Nighttime leg pain can also reflect nerve involvement. Conditions like diabetic neuropathy cause pain, burning, or cramping due to damaged nerves. Spirit. Poor circulation and nerve damage often occur together because both rely on healthy blood flow. When nerves lack oxygen, they malfunction. And spirit. The result is pain that feels sharp or electric. Many seniors describe tingling or numbness along with cramps. When these sensations occur at night, spirit, they are often early signs of nerve issues tied to poor circulation or diabetes. Once nerve damage advances, it becomes difficult to reverse. Spirit. That's why early recognition is so crucial. If seniors wait until the pain becomes constant or numbness becomes severe, treatment becomes less effective. And spirit. Addressing it early through better circulation, blood sugar control, and medical evaluation can slow or stop progression. Spirit. Many people don't realize that nighttime cramps can predict reduced mobility. If a senior wakes repeatedly due to pain, spirit, they may begin limiting daytime activity to avoid discomfort. They may fear walking or exercising because it brings back cramping. And spirit, this reduction in movement worsens circulation, weakens muscles, and accelerates decline. The pain isn't just a nighttime inconvenience. It disrupts sleep. And spirit increases fatigue, affects mood, and reduces engagement in physical activity. All of these consequences combine to create a downward spiral. However, and spirit, early recognition breaks that pattern. When seniors understand the cause and seek help, they can restore confidence and mobility. And spirit, treatments that improve blood flow, such as walking programs, medications, leg elevation techniques, compression, stockings, hydration, and lifestyle changes, and spirit, can reduce nighttime cramps and protect long-term leg health. Another common misconception is that nighttime cramps are simply a normal part of aging. And spirit. While aging affects blood vessels, consistent nighttime pain is not inevitable or harmless. It is a symptom of something affecting circulation vessels, spirit, nerves, or electrolytes. Accepting it as normal creates a barrier to seeking help. Many serious health issues begin quietly. And spirit. Nighttime leg pain is often one of the first noticeable signs of circulatory stress. If seniors address it early, spirit, they can avoid far more painful and dangerous symptoms later. The body doesn't send pain signals without a reason. Especially at night when demands are low, spirit. Pain indicates a gap between what the muscles need and what the blood supply can deliver. And spirit. Understanding that gap turns cramps from a nuisance into a warning sign worth listening to. Ultimately, nighttime leg cramps are not just isolated events. And spirit, they reflect a relationship between circulation, nerve health, muscle function, and metabolic balance. When these systems operate smoothly, cramps are rare. Spirit. When they falter, cramps become frequent, intense, and disruptive. And spirit. Seniors who experience recurring nighttime leg pain should view it as their body asking for attention. It's not about causing fear. And spirit, it's about recognizing early signs that can protect mobility, independence, and long-term quality of life. Tingling, numbness, spirit. Or pins and needles, sensations in the legs are early clues of nerve issues or diabetic damage that can impair mobility. Spirit. And while many seniors simply shake their legs or change position to make the feeling go away, and spirit, the real cause often lies deeper than momentary pressure or poor posture. Spirit. These sensations are signals that nerves are struggling to communicate properly with the brain, and this breakdown often stems from problems with circulation. Spirit. Blood sugar levels or nerve compression. The nervous system relies on a steady supply of oxygen and nutrients from the bloodstream. And spirit. And when circulation weakens or blood sugar becomes uncontrolled, nerves begin to malfunction. And spirit. The earliest sign of this dysfunction is typically subtle tingling, numbness, or a sensation like crawling insects beneath the skin. And spirit. These symptoms can come and go at first, making them easy to ignore, but over time they become more persistent. Spirit. Revealing that the underlying nerve stress is progressing. Seniors who notice these sensations frequently, especially in their feet and lower legs, and spirit, should not simply brush them off as normal aging, because they may be witnessing the first signs of neuropathy, which, if left untreated, spirit, can become irreversible and dramatically impact quality of life. Diabetes is one of the most common causes of nerve damage in seniors. And spirit, high blood sugar harms nerves by damaging the small blood vessels that supply them. When blood sugar levels remain elevated for long periods, nerves become deprived of oxygen and nutrients, slowly deteriorating. In the early stages, this damage manifests as tingling or numbness. And spirit, especially in the toes and feet. Because these sensations are mild at first, many people don't connect them to diabetes. Spirit. They might assume their feet fell asleep or they slept in an awkward position. But diabetic neuropathy doesn't go away just by shifting posture. And spirit. It becomes more noticeable at night because circulation naturally slows and the lack of movement reveals the nerve damage more clearly. Spirit. If blood sugar remains uncontrolled, numbness becomes constant and tingling may evolve into burning, sharp pains or total loss of sensation. And spirit. When sensation disappears, the risk becomes severe. Without feeling in the feet, injuries go unnoticed, leading to infections, ulcers, and in extreme cases. And spirit. Amputation. This progression begins quietly with mild tingling and numbness that many ignore, but early recognition can help prevent long-term complications. And spirit. Circulation problems also play a major role in nerve sensations. Poor blood flow means nerves are not receiving enough oxygen. And spirit. When arteries narrow or veins struggle to return blood to the heart, nerve function declines. And spirit. The tingling sensation many seniors describe is the result of nerves struggling to send clear signals through a compromised network. And spirit. When the supply of oxygen fluctuates, nerves misfire, causing the pins and needles feeling. Unlike temporary numbness caused by sitting too long, and spirit, circulation-related numbness often appears during periods of activity or rest and returns frequently. It may accompany cold feet, skin discoloration, and spirit or swelling. These additional symptoms reveal the connection between nerve discomfort and vascular issues. When the root cause is circulation and spirit, improving blood flow can ease the nerve sensations. But ignoring the problem allows both nerve and vessel damage to worsen over time. Spirit. Peripheral neuropathy is not limited to diabetes or circulation problems. It can also stem from vitamin deficiencies, especially B vitamins. Spirit. These vitamins are essential for nerve health, and seniors are more likely to be deficient due to reduced absorption or limited dietary intake. A lack of B12, spirit, for example, can cause numbness, tingling, memory problems, and fatigue. This condition is treatable if caught early, but if ignored, and spirit, nerve damage may become permanent. This highlights why tingling should not be dismissed as harmless. And spirit, it can serve as a subtle warning sign of a nutritional gap that is correctable with proper evaluation and treatment. Spirit, another factor affecting nerves is pressure or compression. Conditions like sciatica, spinal stenosis, and spirit or herniated discs can compress nerves in the lower back, leading to tingling or numbness in the legs. The discomfort may radiate from the back to the thigh, calf, or foot. People experiencing this often describe electric shock, like sensations or weakness when walking. Spirit. While some assume this pain comes from arthritis or simple stiffness, nerve compression is very different. Spirit. It disrupts communication between the brain and the legs, and if untreated, can lead to muscle weakness or mobility problems. Spirit. The tingling sensation may be the earliest indication that a nerve is being compressed, and acting early can prevent serious impairment later. Spirit. One of the biggest concerns with nerve-related numbness is the gradual loss of sensation. In the beginning, the tingling may feel annoying or strange, and spirit, but as damage progresses, sensation fades. Some seniors begin to feel like they are walking on cotton or can't detect temperature changes. Spirit. This is extremely dangerous because it reduces the ability to sense injury. A blister, cut, or burn can go unnoticed, without pain to alert them. Spirit. Seniors may continue walking on an injured foot, causing the wound to worsen. This risk is particularly high for individuals with diabetes. And spirit. Combined with poor circulation, numbness can lead to ulcers that heal slowly or not at all. And spirit. Preventing these complications starts with recognizing numbness as a signal, not a minor inconvenience. And spirit. The emotional component of nerve damage is also significant. Tingling or numbness affects balance and stability, increasing the risk of falls. And spirit. Seniors may begin to fear walking, especially at night or on uneven surfaces. This fear leads to reduced movement at spirit, which weakens muscles and worsens circulation. The cycle becomes self-reinforcing. Nerve damage leads to reduced mobility. Spirit, which further harms nerve and vascular health. Taking tingling seriously early on helps break this cycle. By seeking evaluation before the symptoms progress, spirit. Seniors can maintain mobility and independence. Early interventions, whether through improved blood sugar control, better nutrition, physical therapy, spirit, or circulation, enhancing treatments have the power to slow or even stop progression. Many seniors normalize numbness or tingling because it develops slowly. And spirit, they may think it's just part of aging, but aging alone should not cause persistent nerve sensations. When these symptoms arise, and spirit, they indicate stress on the nervous or circulatory systems. Even if the cause is not serious, identifying it early ensures better outcomes. Spirit. The nervous system is resilient, but also delicate. Once nerve damage becomes severe, it is challenging to reverse. That's why early warning signs matter. Spirit. Tingling and numbness give seniors a window of opportunity to protect their long-term nerve health. And spirit. It's also important to understand that nerve issues rarely exist in isolation. When nerves suffer, circulation, metabolism, spirit, and muscle function are often involved. Recognizing tingling as part of a larger picture allows seniors to address multiple factors at once: diet and spirit, activity level, hydration, blood sugar, medications, and posture. Each small change can contribute to improvement. And spirit. While occasional tingling after sitting or lying in one position may be harmless, frequent or unexplained episodes should be seen as meaningful. And spirit. They reflect the body's early attempt to communicate distress, instead of waiting for severe pain or total numbness. And spirit. Seniors can listen to that communication now. Ultimately, tingling, numbness, and pins and needles sensations are not just fleeting annoyances. They are messages from nerves signaling that something is off, whether it's blood flow, blood sugar, vitamin levels, or compression. When taken seriously, and spirit, these signs become early warnings that protect mobility, prevent complications, and maintain independence. Spirit. Recognizing them provides an opportunity to act before the damage becomes permanent. Spirit. And that awareness can make a remarkable difference in long-term physical health and quality of life. Spirit. When seniors notice varicose veins developing in their legs, and spirit, the first instinct is often to shrug them off as nothing more than an aesthetic problem or a typical sign of aging. But these swollen, spirit, twisted veins are actually sending a message about the health of the circulatory system, especially when they begin causing pain, swelling, heaviness, and spirit or itching. Varicose veins form when the valves inside the veins weaken and fail to push blood efficiently back toward the heart, spirit, which causes blood to pool in the lower limbs. Over time, this pooling stretches the vein walls and creates those bulging and spirit bluish or purple veins that rise under the skin. While many people see them as harmless and spirit, the truth is that they can interfere with circulation and increase the risk of potentially serious complications. For seniors, and spirit whose veins already face the challenges of age, decreased elasticity, and weakened vein valves, this problem becomes even more significant. And spirit, a varicose vein that hurts or swells is not just a cosmetic issue. It is a red flag that circulation is compromised, blood flow is struggling, and spirit, and pressure is building where it shouldn't. Minimizing this warning can mean overlooking the early stages of conditions like chronic venous insufficiency and spirit, which can progress and lead to uncomfortable, painful, and dangerous situations. As varicose veins worsen, they may start causing heaviness in the legs and spirit, especially toward the end of the day or after standing for long periods. Seniors might describe it as feeling like their legs are full, weighed down, and spirit or throbbing, and they may think it's just due to age or fatigue. However, this heaviness is actually a signal that blood is not being moved efficiently, spirit, and it's lingering in the veins rather than flowing smoothly. The longer this continues, the greater the stress on the vein walls and spirit, which can worsen the inflammation and swelling around the area. Some seniors may start scratching the skin over these veins without realizing it. And spirit, since itching is a common symptom caused by inflammation and reduced oxygen in the surrounding tissues. And spirit, the problem with scratching is that the skin in this area is often thinner and more fragile, making it easy to break the surface, spirit, which can lead to sores or infections. As circulation weakens further, the surrounding skin may start to change in texture or color. And spirit, it can take on a brownish or reddish tint, become dry, or appear scaly. These skin changes might not seem alarming at first, spirit, but they indicate that oxygen and nutrient delivery to the skin is impaired, meaning the tissue isn't getting what it needs. Because of this, and spirit, even small injuries such as cuts or scrapes may take longer to heal, and in some seniors, they might not heal properly at all. And spirit, when varicose veins progress without attention, ulcers can eventually form, particularly near the ankles where blood pooling is strongest. Spirit, these open sores are often slow to close and can become infected, creating a cycle of pain and complications that are extremely difficult for older adults to manage. And spirit, another danger connected with varicose veins is the potential formation of blood clots. Spirit, while surface varicose veins themselves don't always lead directly to deep vein issues, the impaired circulation increases the risk of clot formation. And spirit, clots can develop in the surface veins, a condition called superficial thrombophlebitis, which can cause pain, redness, and warmth over the affected area. And spirit, in more severe cases, varicose veins can indicate underlying venous insufficiency that may lead to deep vein thrombosis. And spirit, which is far more serious because clots in deeper veins can travel to the lungs, forming a pulmonary embolism. Spirit. This risk may not be obvious to a senior who only sees the visible swelling, but beneath the surface, circulation problems raise the stakes significantly. And spirit, beyond physical danger, varicose veins can impact mobility. When pain, swelling, or heaviness makes walking uncomfortable, seniors may begin avoiding movement. Spirit, which worsens the issue because the calf muscles play a critical role in pumping blood upward. Lack of activity slows circulation further, feeds swelling, spirit, and weakens muscles, which creates a loop where reduced walking worsens the condition, and the condition then discourages walking even more. And spirit, without intervention or lifestyle adjustments, this cycle can diminish overall physical activity, independence, and quality of life. Period. Varicose veins can also be a sign that other cardiovascular issues may be developing. And spirit. When veins lose their ability to manage blood pressure and maintain proper flow, it suggests the circulatory system is under strain. And spirit. This can happen due to obesity, prolonged sitting, lack of exercise, or genetic factors, but in seniors, and spirit also reflects age-related weakening of vessel walls and valves. Spirit. Recognizing painful or swollen varicose veins early is crucial because they act as a warning signal that blood vessels elsewhere in the body may also be struggling. Period. Fortunately, there are steps seniors can take to support circulation and ease symptoms. Spirit. Elevating the legs for short periods throughout the day helps reduce swelling and encourages blood to flow back toward the heart. And spirit, engaging in simple exercises like walking or gentle movement, helps strengthen the calf muscles, which act as natural pumps for the veins. And spirit, some individuals may benefit from compression stockings that help veins maintain normal blood flow and reduce swelling. Maintaining a healthy weight. Spirit. Avoiding prolonged standing or sitting and staying hydrated can also play important roles in reducing vein pressure and promoting better circulation. And spirit. Even with lifestyle changes, painful, swollen or itchy varicose veins should be evaluated by a healthcare professional. And spirit, because treatments exist that can relieve discomfort and prevent complications. And spirit. Modern treatments range from minimally invasive procedures that close off damaged veins to therapies that encourage the body to reroute blood flow through healthier vessels. And spirit. Seniors who pursue treatment early may prevent progression to more serious conditions, avoid ulcer formation, and significantly improve comfort and mobility. Spirit. The biggest mistake many seniors make is assuming varicose veins are just part of getting older and therefore not worth worrying about. Spirit. The truth is that veins are crucial pathways for circulating blood, and when they start showing signs of stress through swelling, pain, discoloration, and spirit itching or heaviness, it's a signal that they need attention. Listening to these signs early can help prevent complications, protect mobility, reduce the risk of clots, and support overall circulatory health. When blood clots form in damaged veins, at spirit, it's often the body's way of reacting to sluggish or obstructed circulation. And for seniors, spirit, this can become a silent threat hiding beneath the surface long before obvious warning signs appear. And spirit, clots can begin developing when blood flow slows down or pools in weakened veins, especially those affected by chronic venous insufficiency or varicose veins. And spirit, the valves inside the veins, which normally help push blood back toward the heart, may fail with age, leading to stagnation and increased pressure. Spirit. This creates an environment where blood becomes thicker and more likely to form clots. And while the body sometimes breaks them down naturally, spirit, not all clots dissolve on their own. Some linger, grow, or migrate. Spirit, creating a dangerous situation that many seniors don't realize is unfolding until symptoms become intense or life-threatening. And spirit, one of the earliest signs of a developing clot is sudden pain in the leg, often concentrated in the calf or thigh. Seniors may dismiss it as muscle strain, spirit arthritis, or simple soreness from standing or walking too much, but unlike normal aches, clot-related pain can feel sharp, throbbing, and spirit, or persistent even at rest. The discomfort might worsen when walking or when the leg is touched, and because the pain doesn't improve with stretching or rest, spirit, it should never be ignored. In some cases, the pain occurs alongside swelling, particularly if only one leg is affected. And spirit, which is a key red flag because clots rarely develop evenly in both limbs. Another notable symptom is warmth in the affected area. When a clot forms, and spirit, the body often responds with inflammation, which increases blood flow to the nearby tissue. As a result, the skin over the clot may feel warmer than the surrounding areas. And spirit, and this localized heat combined with tenderness or swelling can distinguish clot-related pain from other leg discomforts. And spirit. Seniors might feel this warmth when resting their hand on the area, or they may notice the warmth intensifies after periods of inactivity. Spirit. This difference in temperature is subtle but extremely important, especially when coupled with redness or discoloration on the skin.